So treatment of bronchospasm. So in treatment of bronchospasm, you need to give nebulization. That is your albuterol, that is 2.5 to 5 milligram nebulized, 4 to 6 puffs, meter dose inhaler. You can repeat it every 20 minutes as and when needed. Okay. Next is your ipratropium bromide, that is around 0.5 mg, that is 500 micrograms nebulized, 4 to 6 puff through the MDI. You can repeat that also as well every 20 minutes. Magnesium sulfate, 2 grams IV over 20 minutes. This is what we give on a standard basis, right? So when does glucagon come into picture? So now your patient who is coming with anaphylaxis is having hypotension as well. And now the patient is already taking beta blockers. Okay, the patient is already taking beta blockers. In that case, your albuterol is also a beta product. Your epinephrine is also a beta product. The patient is already on beta blocker. So these things is not going to work adequately, right? In that case, if your patient is on beta blockers, you're going to encounter a very refractive hypotension. In that case, go ahead with glucagon. Okay, 1 milligram IV every 5 minutes until the hypotension resolves, followed by 5 to 15 micrograms per minute infusion. Okay. So discharge planning with anaphylaxis. First thing is you need to educate the team, educate the family as a whole, and especially the patient. Okay. Identification of the inciting allergen if possible. Okay. Most of them, what we recommend them is to have a diary and a pen. So whatever they eat that particular full day, they need to document it. And if they get an allergy disorder at that particular day, then we'll be sure that this is one among this causing the allergy and this is one of the allergen. So the next day we'll skip some of the thing. They will ask them to consume some new food items, right? So by this way, you can identify which particular allergen is allergic to that particular individual. Okay. Instructions on use of medication, EpiPen, everything need to be educated. Okay. And personal identification allergic tag, if at all an allergen is identified, it's better to give them that allergic tag also as well. So the current reaction prescriptions, you need to give them diphenhydramine. Of course, I told you 3 to 5 days of OP medicines is also required. Corticosteroids, 40 to 60 milligrams of prednisolone or 20-30 milligram per oral twice daily for 3 to 5 days again. So prevention, avoid the allergen. This is the one and only biggest thing which you need to tell the family. Okay. Instructions on avoiding the future exposure of that particular allergen. Okay. And teach them how to use the epinephrine pen.